CEN Exam Prep 2025. Question 1. A patient presents with sudden onset of sharp chest pain and dyspnea following a long flight. What is the most likely diagnosis? Option A. Spontaneous pneumothorax. Option B. Pulmonary embolism. Option C. Acute coronary syndrome. Option D. Pericarditis. The correct answer is option B. Pulmonary embolism. This patient has risk factors, prolonged immobility from a long flight, and classic symptoms of pulmonary embolism, sudden dyspnea and pleuritic chest pain. While spontaneous pneumothorax, A, can cause similar symptoms, the history of prolonged travel makes PE more likely. ACS, C, presents with chest pressure with radiation. Pericarditis, D, pain is positional. Question 2. A patient in atrial fibrillation with rapid ventricular response has a heart rate of 152 bpm and is hypotensive. Which intervention should the nurse anticipate? Option A. Administration of 4-diltiazem. Option B. Administration of 4-amiodarone. Option C. Synchronized cardioversion. Option D. Administration of 4-digoxin. The correct answer is option C. Synchronized cardioversion. In unstable atrial fibrillation with rapid ventricular response causing hypotension, synchronized cardioversion is the immediate treatment of choice. Hemodynamic instability indicates the patient cannot tolerate the rapid rate and requires immediate electrical conversion. Chemical rate control with diltiazem, A, amiodarone, B, or digoxin, D, is appropriate for stable patients but is too slow for unstable patients. Question 3. A patient has presented to the ED with a complaint of chest pain. Which of the following represents an appropriate delegation of tasks to a nursing assistant? Option A. Perform a 12-lead ECG. Option B. Obtain vital signs. Option C. Administer aspirin. Option D. Assess the chest pain. The correct answer is option B. Obtain vital signs. Obtaining vital signs is within the scope of practice for a nursing assistant and is appropriate for delegation. Performing an ECG, A, may be delegated in some states but is often a nursing responsibility. Administering aspirin, C, is a medication and cannot be delegated to a nursing assistant. Assessment, D, cannot be delegated. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. A patient with suspected stroke has a blood pressure of 190/110 mmHg. What is the appropriate nursing action? Option A. Administer 4-labetalol to lower blood pressure. Option B. Administer 4-hydralazine. Option C. Allow blood pressure to remain elevated unless there are signs of end-organ damage. Option D. Administer a nitroprusside drip. The correct answer is option C. Allow blood pressure to remain elevated unless there are signs of end-organ damage. In ischemic stroke, elevated blood pressure is often compensatory to maintain cerebral perfusion to penumbral tissue. Current guidelines recommend against lowering blood pressure unless it is extremely high, greater than or equal to 220/120, or the patient is receiving thrombolytics. This patient does not qualify for intervention yet. Options A, B, and D are not recommended unless criteria are met. Question 5. A patient presents to the emergency department reporting slurred speech and an unsteady gait for about 6 hours with complete resolution of the symptoms. Which of the following statements by the patient would be a priority to follow up? Option A. I haven't been able to refill my blood pressure medication for a few weeks. Option B. I use cannabidiol, CBD, edibles to help me sleep. Option C. I was diagnosed with Guillain-Barré syndrome as a child. Option D. My grandmother had rheumatic heart disease. The correct answer is option A. I haven't been able to refill my blood pressure medication for a few weeks. This patient's symptoms describe a transient ischemic attack, TIA. Uncontrolled hypertension is a major risk factor for future stroke and requires immediate intervention. While CBD use, B, may be important, it is not as critical as uncontrolled hypertension for TIA management. Guillain-Barré, C, can cause similar symptoms but is not the priority. Family history of rheumatic heart disease, D, is less relevant. Question 6. During a disaster drill, which patient should be prioritized for evacuation? Option A, patient with a fractured femur who is stable. Option B, patient on a ventilator. Option C, patient with a minor head laceration. Option D, patient with a sprained ankle. The correct answer is option B, patient on a ventilator. In a disaster evacuation, patients who are ventilator-dependent are the highest priority due to their reliance on life-sustaining equipment and difficulty in moving them. Stable fracture patients, A, and minor injuries, C, D, can wait. Question 7. A patient presents with sudden onset of severe, diffuse abdominal pain that is like a knife. The patient is lying very still. This presentation is most consistent with Option A, acute pancreatitis. Option B, perforated ulcer. Option C, renal colic. Option D, bowel obstruction. The correct answer is option B, perforated ulcer. A perforated ulcer typically presents with sudden, severe, diffuse abdominal pain described as knife-like. Patients lie perfectly still because any movement worsens peritoneal irritation. Acute pancreatitis, A, is often severe pain but more epigastric and often radiates to the back. Renal colic, C, is flank pain. Bowel obstruction, D, is cramping pain with nausea and vomiting. Question 8. A patient with a known history of type 1 diabetes presents with nausea, vomiting, and a blood glucose of 450 mg/dl. ABG shows pH 7.15, HCO 312 milliequivalent/L. What is the priority intervention? Option A, administer regular insulin 4. Option B, administer 4 fluids. Option C, administer potassium. Option D, obtain a urine ketone test. The correct answer is option B, administer 4 fluids. In DKA, fluid resuscitation is the first priority to correct dehydration and improve perfusion. Insulin, A, is given after fluids. Potassium, C, is given after the patient is rehydrated and potassium is monitored. Urine ketones, D, are important but not the priority. Are you looking for CEN Exam actual questions? Visit our website pokerexams.com to access CEN Exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN Exam answer key today. Question 9. A patient presents with an acute shoulder dislocation. The nurse notes the arm is held in abduction and external rotation. What is the most likely type of dislocation? Option A, anterior dislocation. Option B, posterior dislocation. Option C, inferior dislocation. Option D, superior dislocation. The correct answer is option A, anterior dislocation. Anterior shoulder dislocation is the most common type and typically presents with the arm held in slight abduction and external rotation. Posterior dislocations, B, are less common and present with the arm held in adduction and internal rotation. Inferior, C, and superior, D, dislocations are rare. Question 10. Which laboratory finding is most specific for acute myocardial infarction? Option A, elevated creatine kinase -MB, CK-MB. Option B, elevated troponin I. Option C, elevated myoglobin. Option D, elevated C-reactive protein. The correct answer is option B, elevated troponin I. Cardiac troponins, troponin I and T, are the most specific biomarkers for myocardial injury because they are found exclusively in cardiac muscle. Troponin I is not found in skeletal muscle, making it highly specific for myocardial infarction. CK-MB, A, is elevated in cardiac injury but can also be elevated with skeletal muscle damage. Myoglobin, C, is early but nonspecific. CRP, D, is a marker of inflammation and is not specific for me. Question 11. A patient with a diagnosis of bipolar disorder is brought in for mania. Which of the following is a priority nursing intervention? Option A, administer lithium immediately. Option B, ensure the patient is in a safe, calm environment. Option C, restrict fluid intake to prevent water intoxication. Option D. Place the patient in seclusion. The correct answer is option B. Ensure the patient is in a safe, calm environment. Safety is the priority. A calm, safe environment with decreased stimulation can help manage manic behavior. Lithium, A, may be prescribed but administration is a provider order. Fluid intake, C, should be monitored but lithium requires adequate fluid intake. Seclusion, D, is only for imminent danger. Question 12. A patient with suspected renal colic has a temperature of 101 degrees Fahrenheit. What is the priority nursing action? Option A. Administer for pain medication. Option B. Obtain a urine sample. Option C. Notify the provider immediately. Option D. Administer antiemetics. The correct answer is option C. Notify the provider immediately. Fever in a patient with renal colic suggests a superimposed infection, which can rapidly progress to urosepsis. The provider should be notified immediately so antibiotics can be initiated. While pain medication, A, is important, the infection needs to be treated promptly to prevent sepsis. Question 13. A patient has been exposed to cyanide. What is the most characteristic finding? Option A. Cherry minus red skin. Option B. Cyanosis. Option C. Slate minus gray skin. Option D. Flushing. The correct answer is option A. Cherry minus red skin. Cyanide poisoning causes a classic cherry minus red skin color due to high venous oxygen saturation from impaired cellular oxygen utilization. Cyanosis, B, is seen in hypoxia from other causes. Slate minus gray skin, C, is seen in methemoglobinemia. Flushing, D, is nonspecific. Question 14. The nurse is caring for a patient in cardiogenic shock following an ME. Which hemodynamic parameter is expected? Option A. Elevated CVP, elevated PCWP, low cardiac output. Option B. Low CVP, low PCWP, high cardiac output. Option C. Elevated CVP, low PCWP, high cardiac output. Option D. Low CVP, elevated PCWP, low cardiac output. The correct answer is option A. Elevated CVP, elevated PCWP, low cardiac output. Cardiogenic shock is characterized by pump failure, leading to elevated filling pressures, CVP and PCWP, and reduced cardiac output. Options B and C describe distributive shock, such as sepsis or neurogenic shock. Option D is not consistent with any shock pattern. Question 15. A patient in her second trimester of pregnancy presents with painless vaginal bleeding. What is the priority assessment? Option A. Fetal heart tones. Option B. Maternal vital signs. Option C. Cervical dilation. Option D. Contraction pattern. The correct answer is option B. Maternal vital signs. Painless vaginal bleeding in the second or third trimester is concerning for placenta previa. Maternal hemodynamic status is the priority. Assessment of fetal heart tones, A, and contraction pattern, D, are important but secondary. Cervical examination, C, is contraindicated until placenta previa is ruled out due to risk of catastrophic hemorrhage. Question 16. A patient presents with nuchal rigidity, photophobia, and altered mental status. What is the priority diagnostic test? Option A. CT scan of the head. Option B. Lumbar puncture. Option C. MRI of the brain. Option D. Blood cultures. The correct answer is option A. CT scan of the head. While lumbar puncture, B, is diagnostic for meningitis, a CT scan of the head must be performed first to rule out increased intracranial pressure, which would make lumbar puncture dangerous. Blood cultures, D, should be obtained but after CT, MRI, C, is not the initial test. Question 17. Which symptom is most characteristic of a subarachnoid hemorrhage? Option A. Sudden, severe thunderclap headache. Option B. Gradual onset of confusion. Option C. Focal weakness on one side. Option D. Loss of consciousness without headache. The correct answer is option A. Sudden, severe thunderclap headache. Subarachnoid hemorrhage classically presents with a sudden, explosive thunderclap headache described as the worst headache of the patient's life. Focal weakness, C, is more common in ischemic stroke. Gradual confusion, B, is less characteristic. Loss of consciousness without headache, D, is not typical. Question 18. A patient with a history of DVT presents with sudden onset of chest pain and dyspnea. What is the priority nursing action? Option A, administer oxygen. Option B, obtain a 12-lead ECG. Option C, prepare for CT angiography. Option D, administer heparin. The correct answer is option A, administer oxygen. The ABCs are the priority. Administering oxygen to treat hypoxemia is the first step. ECG, B, is used to rule out ME but is secondary. CT angiography, C, is diagnostic but not the priority. Heparin, D, is treatment but follows oxygen and diagnosis.
Stressed about your Colorado real estate? We can take Colorado real estate for you remotely and undetected. We always guarantee A-Pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done.
Question 19. A patient presents with abdominal pain, vomiting, and a blue-gray discoloration of the gums. What heavy metal poisoning is most likely? Option A, mercury. Option B, arsenic. Option C, lead. Option D, iron. The correct answer is option C, lead. Lead poisoning can cause abdominal pain, lead colic, vomiting, and the classic blue-gray lead line at the gingival margin. Mercury, A, causes neurological symptoms. Arsenic, B, causes garlic odor and GI symptoms. Iron, D, causes GI symptoms and metabolic acidosis but not gingival discoloration. Question 20. A patient is brought in with a nail gun injury to the chest. What is the priority nursing action? Option A, remove the nail. Option B, apply pressure to the wound. Option C, obtain a chest X-ray. Option D, assess for pneumothorax. The correct answer is option D, assess for pneumothorax. A nail gun injury to the chest can cause pneumothorax, hemothorax, or cardiac injury. The priority is to assess the airway and breathing. The nail should not be removed, A, as it may be tamponading a bleeding vessel. Pressure, B, may be applied but the priority is assessment. Chest X-ray, C, will help determine injury but follows assessment. Question 21. A patient is brought in after a sexual assault. Which of the following nursing actions is most appropriate when discussing the forensic exam? Option A, explain the importance of the exam and offer to have a sexual assault nurse examiner, CEN, perform the exam. Option B, tell the patient they must undergo the exam to report the assault. Option C, perform the exam yourself to minimize the number of people involved. Option D, delay the exam until law enforcement is present. The correct answer is option A. Explain the importance of the exam and offer to have a sexual assault nurse examiner, CEN, perform the exam. Patients who have been sexually assaulted should be informed about the forensic exam, offered the option of having a CEN nurse, specialized in sexual assault care, and given the choice to proceed. The exam should never be forced, B, and a CEN nurse should perform the exam if available, C. Law enforcement involvement, D, is the patient's choice. Question 22. A patient with a known history of aortic stenosis presents with syncope. Which medication should the nurse avoid administering? Option A, 4-normal saline. Option B, 4-nitroglycerin. Option C, 4-morphine. Option D, 4-oxygen. The correct answer is option B, 4-nitroglycerin. Patients with aortic stenosis depend on preload to maintain cardiac output through the narrowed valve. Nitroglycerin reduces preload and can cause severe hypotension and cardiovascular collapse in these patients. 4 fluids, A, are appropriate to maintain preload. Morphine, C, should be used cautiously. Oxygen, D, is safe but not the primary concern. Question 23. A patient presents following a motor vehicle crash with hoarseness, marked left lateral neck swelling, and respiratory difficulty. The priority intervention for this patient is? Option A, tracheal intubation. Option B, 4 fluids. Option C, needle cricothyrotomy. Option D, pleural decompression. The correct answer is option C, needle cricothyrotomy. This patient has signs of impending airway obstruction from a laryngeal or tracheal injury, hoarseness, neck swelling, and respiratory distress. The swollen and distorted anatomy makes oral or nasal intubation, A, likely to be impossible or dangerous. Needle cricothyrotomy, C, provides immediate airway access below the injury. For fluids, B, and pleural decompression, D, are not the priority for airway compromise. Question 24. A patient with heart failure presents with acute pulmonary edema. The nurse anticipates which initial medication? Option A, for furosemide. Option B, for morphine sulfate. Option C, for nitroglycerin. Option D, for dobutamine. The correct answer is option C, for nitroglycerin. For acute pulmonary edema, for nitroglycerin is often the first line medication as it causes venous and arterial vasodilation, reducing preload and afterload, and quickly relieving symptoms. Furosemide, A, is used for diuresis but takes longer to work. Morphine, B, is used cautiously and is not typically first line. Dobutamine, D, is for cardiogenic shock with low cardiac output. Question 25. A patient is brought in with a diagnosis of schizophrenia who is actively hallucinating. What is the best nursing approach? Option A, tell the patient the voices are not real. Option B, ask the patient what the voices are saying. Option C, ignore the patient's hallucinations. Option D, place the patient in restraints. The correct answer is option B, ask the patient what the voices are saying. It is appropriate to ask the patient about the content of hallucinations in a non-judgmental manner. This helps assess for command hallucinations that may be dangerous. Telling the patient the voices are not real, A, denies their experience. Ignoring, C, is dismissive. Restraints, D, are unnecessary unless the patient is a danger.